such a pleasure seeing you. Yes, doctor. Hello viewers, welcome to this interview, a lively talk that I'm going to have with one of the most eminent doctors in his chosen field. His contributions to the mankind is really immense. Having his origins from India, he lives in USA for close to over 5 decades now. Traveled all over the globe to popularize the knowledge and skill that he has acquired. There have been illustrious contributors in the field of biomedical engineering, and their contributions have increased the life expectancy. One such eminent doctor is whom we are going to talk today, and we shall have a good opportunity to know about his passion for the subject, the way he has brought about this biomedical engineering, robotic surgery to be very specific, and he's an inspiration for others. I am really excited welcoming Dr. Mani Menon to this lively talk. Good day, Dr. Mani Menon.
Good day, Mr. Iyer. How are you?
Yeah, great. I searched the Google to find who is the father of robotic prostatectomy, and you know what? The first results came up giving your name, Dr. Mani Menon. You have evolved a method of robotic surgery to find cure to prostate cancer, and is called Vattikuti Institute Prostatectomy. You are a genius, as your friends call. Let's start our dialogue with this note. I know just with the skills alone is not the eminence that you have acquired. The way you care for the patients, the emotional support you give for the patients with kindness and comfort must have roots in your skills of robotic surgery. Give us a small little intro about this, doctor. Of course, we'll be talking about this in detail, and just for the benefit of the viewers, you could tell us in a short gist as to what is robotic surgery.
Robotic surgery is a way in which surgeons can increase, develop upon their God-given talents to help patients. So, if you will, an analogy that I may make is that, when I was in India going to school and growing up, we would write letters and then we would mail them, and it was a very enjoyable experience. Very few people actually handwrite letters anymore. We use the email. And in a sense, we are communicating the same things, but the email gives us a facility that we didn't have when we had to handwrite the letters. So robotic surgery is, someone has to write the letters, whether you're writing it by hand or whether you're typing it by email. The author has to be there. And it's similar for robotic surgery. The surgeon has to be there to do the operation. The robot is just a sophisticated computer that takes the surgeon's motions and exaggerates them and offers many other advantages. Is that a reasonable analogy, you think?
Yes, it gives a fair bit of idea of what robotic surgery is about. And the robotic surgery, as I've heard you saying earlier, is one should know when not to operate. And the second part of the surgeon is knowing how to operate and how to handle patients before and after surgery. This, I guess, must be another important criteria when you try to operate on a patient to take him into robotic surgery.
Yes. So the robot does not substitute for surgical judgment or surgical experience. It certainly does not substitute for the compassion and the wisdom that you alluded to early, but it is an enabler. Given good surgical judgment and good surgical decision making, the robot can help you actually accomplish things.
So it's only when it is necessary you go in for robotic surgery. Otherwise, you don't intend to do all surgeries through robotic. Am I right?
So the field is developing, and I want to take a step backwards and allude to your kind introduction as my being the father of robotic surgery and the father of robotic prostate cancer surgery. That is true, and I don't say this to glorify myself. It's an inarguable fact that I was in a position at the right timing and I had the right DNA to make this difference. However, what is being done 20 years after I started is unimaginable. And I think there are many people in the world who now use the surgical robot in many, many different fields who are just as good as I am in doing it. If I were to take any parochial interest, it's that I helped train most of these people, and almost all of them, I gave them an edge and showed them what is done. But there are, it is now very much the standard of care in the US. I think over 8 million patients have undergone robotic surgery, maybe 10,000 of them operated on by me, 100,000 operated on people whom I trained directly, and over 2 million of people who are second generation, people who were trained by people whom I was trained. So why am I saying that? I think we are scratching the surface of robotic surgery, and more indications are being discovered, and more people are learning how to use the robotic tools in an innovative way. For example, there was a competition that the Vattikuti Institute in India held for the best robotic procedures done in India. A young surgeon from JIPMER, Pondicherry, my alma mater, won the award, and it was incredible the complexity of procedures that he did and the case that he presented. I'm happy to be part of it from two things. One is developing the robot, and the second thing is the fact that someone from my medical school actually had taken it and has developed it so brilliantly.
Doctor, I'm happy as well for two things, and I'm one among the 10,000 people whom you have operated upon.
Yes.
And after 11 years of surgery, I'm still kicking around, and I feel you have given me a rebirth, and I'll talk about it a little later as we go along. And now you are in the Mount Sinai Health Systems in New York, Dr. Mani Menon, and you are the Professor of Urology and Chief of Strategy and Innovation in the Department of Urology. You are also the Emeritus Director of Vattikuti Urology Institute, Detroit. And all started, your career started, if I may say, in early 60s, isn't it? With
Yes.
Johns Hopkins University. And you have said that your mentor was Dr. Patrick Walsh.
Yeah, so in the early 60s is when 1964 is when I started medical school in JIPMER. 1974 or 75 is when I first started working at Hopkins with the Pat Walsh.
Mm-hmm. And you did some research on androgens, if I'm right, which are required for the normal growth and function of the prostate.
Yeah, so when I started doing research, the concept that hormones act by binding to certain structures called receptors was just coming into play. And the field for breast cancer receptors was a little bit more developed than for prostate receptor, for male hormone receptors. And if I might just bring a loose connection that we never talked about, one of the pioneers in the world of breast cancer receptor research was none other than Shyamala Gopalan from Chennai. Kamala Harris's mother.
I see.
Yes, yeah.
Great.
Yeah, and so, of course, I didn't know that at that time. So when I was a resident in training, Dr. Walsh told me to go into the lab and figure out a way to measure the receptor in the prostate. And, by good fortune and by good fortune primarily, we came up with a measurement of receptors in the prostate. This is 1976, and that technique is still in use in 2021, which is really unimaginable that something could stay pretty much unchanged over a period of time.
And your journey, you all started with JIPMER Pondicherry in India,
Yes.
And it's so nice. You're from our land here, and maybe you have a lot to say more about your JIPMER days and how you landed up in the United States.
JIPMER was an eye-opener for me. I grew up in Kerala in a reasonably conservative family where, it was typical of anybody who grew up there, where your life was really controlled by your elders. And in my case, my father had died while my mother was carrying me, so I never met my father. My grandfather, who is a tremendous person, I feel about him the way you felt, you wrote about your father, and I still feel about him that way. Yes, so my grandfather was clearly the patriarch of the family. And then it was my mother, who was a young widow who only had one person in the world who she could care for, and that was me. So, but I had no independent thoughts whatsoever. I just did what my grandfather and my mother told me. Yes. And then I went to JIPMER, which was and I think still is a fantastic place. I think it's number 40 in all medical schools in the world, or something like that. It's used to be number 3 in India. Now it's number 5, I think. But we thought it was number 1, and it really was, in terms of being a physician. A lot depends on how much you know and the science behind it, but there's a lot of emotional intelligence and empathy. You alluded to this, Mani, early on. It's not just the surgery, it's the overall patient care, and JIPMER did give us that. It's not a private hospital, it's a public institution, so not one patient paid a penny. And we looked after all of them the same way. It was, I think at that time, the second national school in India. All India Institute of Medical Sciences was the first one. And we had people from all over India who came in together from different backgrounds. We stayed on an idyllic campus and we made very, very strong friends. I made the strongest friend that I have, my wife. We were medical students together. So it's hard for me not to look at the JIPMER days without looking at it through rose-tinted glasses.
Yes, yes. And from JIPMER, you went to Johns Hopkins, and then after that, after many years, you joined the Vattikuti Institute, and where you pioneered the Da Vinci robotic surgery techniques during your tenure there at Vattikuti. You often recall the support and encouragement you have received from Mr. Rajendra and Mrs. Padma Vattikuti, and the noble couple that they are, the chairpersons of Vattikuti. The focus has been on oncology and its treatment. If I may be right in saying that it is their encouragement that also enabled you to pioneer this robotic surgery. Am I right, Dr. Menon?
Without question. Mr. Vattikuti is a software engineer who had trained, who went to college at Guindy, and he had strong connections with South India. He came to Detroit and he became an entrepreneur. Was one of the first people, maybe the first person, to look at outsourcing to computer engineers in India. And if you, this is arguable, but you can say that it was his vision that has opened up a whole new world for all the software people in India, for all the computer engineers, because he was the one who made the bridge to getting them into the United States, and which is an incredible, conceptual contribution. And when he was, I think in his early 40s, he wanted to give back to the community. And somewhat like me, he had two communities that he wanted to help. One is the community that made him financially successful, which was in Detroit, Michigan. And the second is his community in India. So he wanted to somehow give back to the Indian communities. And I met both these things. I was a conduit for him to give back to the community in Michigan and also the community in Detroit. And when I met him, he said, I would like to make a substantial philanthropic contribution. I don't want it to go to institutions, with a lot of bureaucracy. I've made my career by focusing on people, and I like you, I'd like to support you. And what I want to do is for you to make a difference in prostate cancer. And you told me about your measuring the receptor and how that is important. That's not the contribution I want. I want to see a direct benefit to the community. So if I go to a restaurant, I want the waiter who is serving me to say, Mr. Vattikuti, thank you for doing this because this has helped my uncle or my cousin or me. And that's the only thing that he suggested. And I thought that if we could make surgery, any surgical procedure, more gentle, this would be a good thing that I could do for meeting his wishes. In particular, while surgery for prostate cancer is curative, traditional conventional surgery where you cut the patient open and take the prostate out and sew it back together is not for the lighthearted. It is tough for the doctor. And if it is tough for the surgeon, imagine how much tougher it is for the patient. So he liked the idea that we could try to make this operation easier on the patient. um, going back and thinking about it, it is incredible good fortune, or God was guiding me to put us both together, because it's not easy. America runs on philanthropy, but there are many, many strings attached to the philanthropy. There were no strings attached to Raj's philanthropic contribution. He just said, go help patients. And, and I would go back with some ideas and say, don't you want to approve it? He says, no, just go ahead and do it. And I said, well, how do you know that I won't waste your thing? And I said, well, I made my name, my business in trusting people. I trust you. And, I'm going to contribute every year for the next 20 years. If I don't like what you're doing, I'll simply stop contributing, so.
That's really great of Mr. Rajendra to do it. And it's very rarely we come across such people. And Dr. Mani Menon, I feel like pinching myself because I'm talking to one of the most eminent doctors on an interview across the globe. And very rarely does one get even an opportunity to talk like this. And what a fantastic achievements you have gained in your career. You have won the Gold Cystoscope Award, which is one of the most recognized awards that a doctor can get in United States. And of course, Dr. B.C. Roy Award from your motherland. It's great that they have recognized your services to the mankind. And the American Robotic Urological Surgeons named a medal after your name. A fantastic and you have also been in the Presidential Advisory Board of President Bush and Clinton. And how many people have had such type of great opportunities in life? It's more than what you have achieved. I feel proud that I'm talking to you today on this, and it's great. It's wonderful, Doctor. It's wonderful. And you also have the member of the Society of Scholars in Johns Hopkins University. Please tell me something about it. I think it's a very rare recognition that someone gets to be a member of the Society of Scholars in the Johns Hopkins University.
So we briefly talked offline about it, and I'm glad you asked me the question. I think I alluded to the fact that much as I owe my medical school to JIPMER, I owe my urological career to my training at Hopkins. And just because of some fluke, I was the first person of Indian origin who trained in any of the surgical disciplines at Hopkins in 103 years. Wow. I think 50 years later, another person has gotten in. So it's a very competitive place, and mainly because of good fortune, but a little bit because of hard work, I was able to get that. And I alluded to the fact that my thinking was very structured, and Indian medical education makes it structured. If you see a patient and you examine the patient, if your professor tells you that you made the right diagnosis, you made the right diagnosis. If the professor says that you made the wrong diagnosis, then you were wrong. What Pat Walsh and Hopkins taught me is to be critical about anything that is said. I mean, if your professor said that this is the right diagnosis and you did not agree, then it was up to you to talk to the professor and express your ideas as to why you respectfully disagree, and then question the existing dogma. This is how the receptor business came by. I mean, at that point, there were some techniques that were used to measure the receptor. To me, none of them was working. So I said that we have to come up with a new way of measuring the receptor, and that turned out to be right. And 30 years later, I felt that there was a better way of doing surgery, and that's what we did. So Hopkins has a university-wide award that is given to people who were affiliated at Johns Hopkins and then had left Johns Hopkins and who have made distinguished contributions. For example, one of the scholarly contributions. I mean, there are lots of people who've gone from Hopkins and have contributed a lot. Michael Bloomberg, the former mayor of New York, is one of that. But this is for people who've done scholarship. For example, one person who has been given the award was a physicist who first showed the presence of water on one of Jupiter's moons, and he was the first person to show that. He runs the Hubble telescope, which is the telescope that uses very high definition photography of planets and asteroids. Nothing to do with robotic surgery, right? But that's someone who is a scholar at Johns Hopkins. Another person who is a scholar at Johns Hopkins was the first African-American woman who became an admiral in the U.S. Navy. And I was given, I became a Hopkins Scholar a few years ago for my contributions to robotic surgery.
Great. And there again, the Smithsonian National Museum of American History, where they recognize great personalities in multivarious fields such as political and science, political culture and science, so on. There again, you have got a recognition there where your robotic arms and your attire is on display there for the next over 16 years, something which just about 3-4 doctors have got, if I'm right, over the last 3 centuries, 4 centuries.
Yeah, so the Smithsonian is America's national museums, and
great, it's wonderful.
One of the museums is the Smithsonian Museum of American History. And this particular exhibit, and some of your viewers might want to look at it, it's a kind of a neat exhibit. It's called One Nation, Many Voices. And it was established to recognize the contribution of immigrants to America from the year 1600 to the year 2000, so over 400 years. I mean, people like Albert Einstein are in that museum. For the year 2000, they chose to use to recognize the contributions that robotic surgery has done to the United States. So Mr. Vattikuti is there for his contributions in bringing Indian intelligence to the software industry. And Mahindra Bhandari, who is a distinguished physician, and you may have seen him when you were there, or he may have come. He was there when you were there. He's been there.
Dr. Satya was there.
Yes, Satya Narayana was there. So Dr. Bhandari was also there. And Dr. Bhandari was the Vice Chancellor of King George's University in Lucknow. He's a Padma Shri, very well distinguished. And so the three of us are in that for our contributions to robotic surgery. But since they were focusing on robotic surgery, they focused more on things related to the actual surgery, which is the robotic arm and the instruments and my white coat.
Great.
So in a sense, this is not because of my contributions to American medicine. It is not because of what we did for healthcare. It is a contribution of what three immigrants gave to their adopted country, the US.
Wow. Okay, great. Now, at this point, Dr. Mani Menon, I must tell the viewers in what way I have been benefited by you about, I think it was the year 2010, 11 years ago. And I had a urinary infection when I went for checkup and the blood test. And it was revealed that my PSA read 3.5. And I came to know that up to 5 or 6 PSA is okay. Then when I went and met the doctor, Dr. Murali Venkatraman, who is the urologist in the Apollo Hospitals, Chennai, he wanted to examine me. And on examining me, he ordered to go for a biopsy. And I asked him why. He said, no, I feel that you should go through a biopsy. And he examined the rectum. And it was quite painful. I must say now, recalling the whole thing, the experience of undergoing biopsy was more difficult than the robotic surgery itself a little later. And then when the results came out, well, the unexpected was announced to me saying that I had prostate cancer, but the good news was it had not come out to the onto the nodes outside. And the doctor explained to me about various options, and I chose the robotic. And I searched many centers in US, and finally chose Vattikuti and came to you. I must say, I must tell to the viewers, Dr. Mani Menon is God sent to me. I'm reminded of popular author and philosopher Deepak Chopra. He is again an Indian settled down in USA. Everything happens for a reason, he says, despite appearance to the contrary. How blessed I feel that I met you many, many years ago. And I feel that, again, Dr. Deepak Chopra says, one should look for coincidences in life and to realize that something is happening in your good favor. And when I come to you and you have my father's name, Dr. Mani, who was also an orthopedic surgeon, he was no more then, but then I felt so safe in your hands that my father is going to take care of me when I came. And then when I walked into the room of Dr. Satyanarayana, I saw the picture of a deity of Goddess Sharadamba, whom I believe a lot. He is also from Mysore and he believes in that goddess. And when I saw the goddess, I said, well, there again I had the blessings. And later on, what a coincidence, I get to know that your first friend in JIPMER is named Shankar. So such a lot of coincidences. And today, if I'm hale and healthy today, all credit should go to you. And the skillful, artistic, robotic surgery that you have developed for the benefit of the mankind. And I wish to just narrate 2 more instances before we carry on with our talk, Dr. Mani Menon. I very distinctly remember a day before the surgery, you called me and my wife and you took us to a chapel which is situated in the hospital. And you prayed along with us for my good health. I felt so moved that the operating doctor is there to pray along with me for my better health. And everything went on well on the day of the surgery. And after 5 days, you called me over to inquire about my good health and my recovery. And you suggest that you take me out to treat me to a South Indian restaurant. You treated me with masala dosha and your wife, kind wife, Dr. Mani Menon, was also there. I don't know if you recall, I asked you, Doctor, how do you find time to spend so much with the patients? You were so humble, and you just gave a smile. I felt so very moved, so that is the greatness, and the skill is one side, and then the emotional support that you give to the patients pre-operatively and post-operatively, I'm sure that is contributed equally in making you a luminous doctor in this field. So I really thank you for your skillful hands that put me out and gave me good health again. More about you, Dr. Mani Menon. Tell me something about the techniques of surgery that has evolved over the years. We are talking about robotics today, and you are also of Indian origin, and in Indian science, in Ayurveda, they talk about surgery 5,000 years ago in their literature called Sushrita Samhita. And Salya is the text which talks about surgery. Is the techniques of surgery of what is available today, has it come out, has it evolved out of this literature that is available in the Indian origins? What do you think, Doctor?
So the Sushrita Samhita was clearly something that we referred to in JIPMER in medical school. There were portraits of, there's a photograph of Sushrita operating and actually doing plastic surgery that we had in our hallway. Not very well known in the US. Somewhere in the year 800 AD, I think. So it's 1400 years ago, and had a wide range of surgical procedures that he pioneered. Has surgery evolved over the years? Well, without question. Is surgery better than in the years of Sushrita? Yes. And the big developments in surgery were two things. One is antisepsis, simply that you should wash your hands and then there will be less infection. And this was pioneered by Joseph Lister in Glasgow and in the UK. It's a very, very simple concept that seems intuitive now, but was met with widespread animosity. The feeling at that time is that infections are good for healing, and that when you get infection, you make pus, and pus is healthy. And if an incision heals without pus, then it's not strong enough. And for Lister to show, no, that infections are not good and that washing your hands makes a big difference, that's been tremendous. Hundreds of millions of lives have been saved with that. The second, there are three A's that I should talk about. The second chronologically advanced was anesthesia. In Sushrita's age, either you gave the patient a lot of opium and knocked them out, or you had strong people hold the arms down and you did the surgery while the patient was screaming with pain. And you really can't do a sophisticated operation when a patient is writhing and moving around, plus the fact that it's terribly inhumane. Several people were responsible for techniques where a patient can be put to sleep, essentially taken halfway to death. The surgery is done with no pain, and then the death process is reversed. And that's a huge benefit, anesthesia. Surgeons had nothing to do with this. This was the anesthesiologist, our partners, who are even to this date not given the credit for the advances that they have made towards surgery. Mm-hmm. And the third is antibiotics. Antibiotics, in addition to washing hands, can quell infections, and the millions and millions of lives that are saved are because of antibiotics. Mm-hmm. Interestingly, how antibiotics were developed is an insight into how changes can be made from unexpected quarters. There was a person who was growing bacteria. His name was Alexander Fleming, and he was working in a small lab that was hot. It was a summer month, and he was growing plates of bacteria, and he left the window open, and he put the bacterial plates in the window because the lab would cool off at night. And one morning when he went and looked at the plates, he found that the bacteria had died. Instead of the colonies growing, the bacteria died. And this is because he did a sloppy experiment. I mean, he should have closed the window and put the plates in warm temperature where the bacteria could grow. But because he had exposed the bacteria to the cold things, they died. And now any respectable investigator would feel ashamed of what he did and throw away the results and then start off from the beginning. But he didn't do that. He looked at it and he said, what killed these bacteria? And he found out that what killed the bacteria was a fungus that had contaminated the plates. And then he isolated the fungus and isolated the chemical that the fungus made that killed the bacteria. Okay. So this is why it is called antibiotic. I mean, this was a natural organism that created an agent that prevented infection.
Is it the fact that yes, please tell me.
So the three things I think are antisepsis, anesthesia, and antibiotics. They have changed surgery beyond recognition.
Now, is it also to be considered that antibiotic leaves a person with side effects or something like that?
Yes, I mean anything that you do, there will be side effects. The side effects that you are alluding to is that antibiotics are they'll use like water, and many times when you don't even need to do that. I mean, for example, if you took your grandchild with a runny nose to a doctor, there is a 50% chance that the doctor would prescribe an antibiotic. And there is a 99% chance that the child does not need an antibiotic because the cold is from a virus. It's like the coronavirus, a variant of the coronavirus, and an antibiotic won't help it. But it is so laden, if a child has a runny nose, there is pus coming out of the nose. Oh, pus is, use an antibiotics because there is pus there. So, sometimes it's needed, but many times it is overused. And when antibiotics are overused, the bugs, the germs, mutate, much like the Delta variant for the coronavirus.
Yeah, yeah.
These bacteria will mutate, and the antibiotic no longer is effective, and you have to come up with a second generation antibiotic and a third generation antibiotic. So that is the biggest.
And one more thing I wanted to tell you. If you recall, when I spoke to you from India, when I was diagnosed with prostate cancer, and looking at my pathological report, the biopsy report, you said you need surgery. I asked you whether I should go in for an MRI or a CT scan to double check. You said, no, don't do that. Just come over, you said. You are so sure, In fact, I like the way you are on the dot. You are so sure that you didn't want to look at the CT scan and MRI. So does the Gleason score gives you that definitive indications? And if so, why CT scans or MRIs are being suggested when they want to see whether there is cancer in it or not?
Similar analogy for antibiotic uses. In certain instances, the CT scan and the MRI are useful. Between 2010 and 2021, the technology for an MRI has been improved so that it is useful much more now than it was before. I still think that most people don't need CT scans and most people don't need MRIs, but there is more value from it now. There is an agent that is widely used in India called a PSMA PET-CT.
Yes, PET-CT is very popular.
That I think is the most important technological advantage for the diagnosis of and staging of prostate cancer that has come around in 20 years. The second thing is the MRI. I still am not a huge fan of the MRI, but I'm walking back a little bit of my things just because the technology has improved. And if it is used for specific instances, I think it is good. I mean, if your granddaughter has a cold, there are specific instances where antibiotics should be used, but not for every cold. And so MRI should not be used for every prostate cancer, but there are many cancers where it will be helpful.
Okay. That gave you such a lot of confidence that you are able to, on the spot, say what is required for a patient to take it further. Well, the advent of computers over the recent past has really brought about these MRIs, PET scans, and CT scan. And it has advanced the biomedical engineering field to a great extent. And laparoscopy has was on through that only the robotic surgery has evolved, I guess. And now people are talking about artificial heart and artificial liver. The present day of robotic surgery, doctor, we call it as robotic surgery. What is robotic in it? What is it? I mean, just for me to understand, vis-a-vis computer-assisted surgeries and laparoscopy, how is robotic one step above this? Just for our understanding.
So, the first thing is that robotics is just one way of doing a minimally invasive surgery. And invasion in this instance means that invading the human body. So if you, before the onset of robotics or laparoscopy, if your prostate had to come out, we would have to make an incision about this long. Why do we have to make an incision that long? Because my hands are this big and my hands have to get inside your body to take the prostate out. With robotics, the incision can be this long or even smaller because the instruments are like this and you're doing the operation using instruments there. The human hand, you can move my wrist this way, I can move my wrist that way, I can move my wrist this way. With the robot, you can do a 360 movement. You can move it like your instrument like that, then turn it around, then move it there. So you can see that you can get into nooks and crannies of the human body without invading the rest of it. So if I have to take out your appendix, I can just put a camera right next to the appendix and take it out. Whereas if I was to do conventional surgery, I have to open the body up, get my hand in to take the appendix out. So that is the advantage of robotics. Now, the particular robot that is being used, and there's just one company that makes it across the world, has designed it that the surgeon can sit in a chair, much like you are doing, and put his head in a video console, and they have exquisite three-dimensional visualization, which you can magnify 50-fold if you want. So a 1 centimeter area becomes essentially a 50 centimeter area, and so you can be so much more precise because everything is kind of blown up. And I don't think this was their intention, but ultimately this has been a completely comfortable work environment. Mm-hmm. You know, it's like going to Woodlands and having a cup of coffee, you know, where you're sitting comfortably in a chair and you're having a cup of coffee. So you're sitting comfortably in a chair, putting your head in the console. There's no bleeding whatsoever because you're only operating on the area you want. Each blood vessel is magnified 50 times, so you can control it before you cut it. And this has increased the value of surgical experience. So I was the busiest surgeon in my department until I turned 73, which was in July. I've taken a year off to when I moved from Detroit to New York to get adjusted to my new surroundings and to go on to the next phase of my career. If I had not been doing robotic surgery, I mean, most surgeons who were doing prostate cancer work had stopped operating when they were 65. So it's given me 10 additional years. And you know, and it's given me 10 years more of experience that I can utilize for my patients.
And 10,000 surgeries you have done, it's incredible, isn't it? I guess by that itself could be a record in the books of robotics.
It was for a period of time, but there are surgeons now who have done 15,000.
Oh, really? Okay.
Yeah. The other things that I like doing, which is taking you to the chapel and praying and buying masala doshas for you, I can't do that when I'm doing 15,000 cases. I can do it when I do 10,000. You know, so I've cut back, and I realized my passion, much as it is in looking after the individual patients, as you discussed, it is also training people. And if you train someone, you have to make sure that your patient gets the same quality of care that you would. So it essentially means slowing down and making sure that things are done properly. And another passion is discovering new approaches, as you correctly pointed out, or as we talked about. The robot is not an autopilot. You don't just press a button and say, take out Mani Shankaraya's prostate, and the robot takes it out. I have to do the operation. I have to do every step of the 10,000 steps that are involved in removing the prostate. So to me, this allows me to modify the operation. And one of the concepts that I came to, and I haven't completely proven this. I've proven it to myself, but I've not proven it to the world, is that 80% of people with the kind of cancer that you have, who are undergoing surgery, you don't need to remove the whole prostate. You can remove 95% of the prostate and leave certain vital structures. And if you leave those vital structures, and if there's no cancer in them, so you have to do a very sophisticated biopsy to make sure that you're not leaving behind any cancer. So if you can do this operation, leaving a little rim of prostate. So if the prostate gland is like an orange, and the cancer is in the flesh of the orange, you take the orange out, but leave the peel of the orange. And the peel is where all the nerves are that maintain urinary control and sexual function. And you have done well, but there are people around the world who the cancer is gone, but they are in diapers and they don't have, they're not able to function sexually, and so their maleness is affected. And it doesn't bother some people. They all they say is my cancer is out, but many people it affects the quality of life. So this new procedure that I hope to introduce to Mount Sinai. We've done it in Detroit. I've done it in 120 selected patients over 5 years. And I want to take it to New York, where there will be a bigger audience. But I'm the only person in the world who is doing that procedure. I do it very carefully, but I'm excited about it, and I hope to be around for 5 years more to do it.
Sure. In fact, I wanted to ask you something a little related to this. While talking about the precision of the robotic surgery. And before that, I just want to ask you, Doctor, well, all this robotic surgery started in Europe, and if I'm right, you went to Europe to pick up this technology and brought it to United States. Am I right? Is it more prevalent in Europe than in US, or?
So you're partly right. The technology, the company made the technology to utilize in heart surgery. And so they released the robot, or a few heart surgeons bought the robot to use it. And it was released in Europe before the US because regulations for technology back then were easier in Europe than the US. So they simply couldn't get it approved in the US. So it had been used by cardiac surgeons there. So I went to see them using it. I thought we could use it for prostate cancer. And I got the robot in Detroit, thanks to Mr. Vattikuti. This was robot number 19. There were 18 other robots in the world, but nobody knew how to use the robots. So I knew how to use the robot. And a simple example that we had is that we measured the time that it took for me to do the prostatectomy. And the first operation I did, it took me 8 hours to do the prostatectomy. By operation 4, I had brought it down to 3 to 4 hours. And then it continued to go to about 90 minutes. So one of my residents, Alok Srivastava, carefully jotted the time that it took to do the robot. But what I did not realize is that the same information is available to the company, because after all, the robot is a computer. So, I could say this is how long it took me to do the operation, but the company knows when did I switch on the robot, when did I switch off the robot. They have that information. So the CEO was telling me that when they looked at my data, my operative times went like this, from 10 hours to 4 hours to 3 hours to 2 hours. And it was a very smooth curve. And they said the 18 cardiac surgeons who were using it, their operative times went like this.
Okay.
So to a computer engineer, the cardiac surgeons were not learning how to use the robot, or the robot was not helping them for their procedures. Whereas for me, I had figured out a way to use the robot.
Okay.
I don't know how we got into that. So that's
more of a skill than computer engineering, I suppose.
That's more of a skill than
passion for that.
This is, I think we started off saying you have to know what you're doing, and I think I knew what I was doing, and somehow my brain was wired so that I could figure out where the robot could help me and where I could help the robot, and and did it.
And all this is just with the 4 arms in a robotic equipment with foot pedals, and you have to flex, very artistically move your hands to do this. It's like bringing out a beautiful artistic performance.
I think when I watch some of the people I have trained, and they don't have my hang-ups and my inhibitions, it really is a symphony in surgical skills.
Yeah, I know. Yes. You should have the rhythm, isn't it? So that I suppose applies to any field, whether it is medicine or fine art.
So the thing about robotics is that you can measure all of this. Without robotics, if somebody told you that they were a great surgeon, then you just had to take their word for it. With one interesting experiment was done by one of my residents, very brilliant chap named Khurshid Guru. Khurshid works in Buffalo, New York, and he felt that what he wanted to measure is the mental ability of the surgeon. And so he put electrodes on the head of the surgeon, and he looked at the brain activity as the surgeon was doing the procedure. And he would look at people who were learning, and much like I showed you, the brain waves were going like this because they were uncomfortable about what they were doing, and their brain was kind of processing that. When he looked at the activity of a master surgeon, it was almost as if the surgeon was dead. When the brain activity was flat, because they knew what they were doing, and that translated into economy of motion and very precise outcomes.
Like you managed to keep your brain empty of other thoughts, and then you're able to bring in so much of focus in what you're doing.
Yes, I mean, I think your friend Deepak Chopra would say that we were meditating while we were operating.
I don't know, there's apart from precision, so less blood loss, less hospitalization. In fact, I remember I wanted to be in hospital for one more day, and you came in and said, this is a place with a lot of bacterial infection. I would prefer that you get back to your place, and you're fit enough to walk. And I was struggling to walk the next day, and then the nursing assistant lady there, she sort of scolded me, and she said, "You've got to get up and walk." And I thank her for that. And so I was able to do it. And it's all a dream that I had gone through. And today I'm so very thankful to you, Dr. And as I said earlier, the biopsy pain was hanging around with me for about 2 weeks now, but then this surgical pain wasn't there.
There are ways in which the pain of the biopsy can be reduced by giving a local anesthesia in a different way. But one of the things for my new procedure is I have to very precisely localize where the cancer is, or actually localize where the cancer is not. And we have gone to doing biopsies under conscious sedation. And I don't know whether you've ever had or people who've had a GI procedure like a colonoscopy, and most places that is done with conscious sedation. So now the way we do the biopsy is that I would go and tell you, Mani Shankar, I'm getting ready to do the biopsy, and I will come and talk to you when the biopsy is done. And then the anesthesiologist, again, remember I told you the power of anesthesia, would sedate you. You're not completely put to sleep, but you are sedated. And then I would come up and talk with you, and 10 out of 10 patients will say, well, when are you going to start the biopsy? And I've done the biopsy already.
Okay.
With 3D guidance and computers and very specific placement of the needles. So most men now don't have the pain of the biopsy.
I see. Great.
The pain is not actually the needle going, it's the pain because you remember the procedure. Now, you know, if you don't remember the procedure, then of course you don't have any pain.
Yes. Just a couple of more questions, Dr. Mani Menon, before we sign off. And, you know, this, I just want to know the future of robotic surgery. When you're sitting on the console and operating on the patient who's away from you, is there a possibility that you can sit in the United States and operate on a patient in future? Patients in India, or for that matter, any part of the world, by using the cutting edge technology of the internet? Is it possible?
I mean, it's not possible. It can be done. The downside in it is just, technological, the bandwidth that we need to do. So with 5G and 6G coming, if that is something that you want, that can easily be done. We did a version of this. Mahesh Desai is a very prominent urologist from Nadiad, India. He organized a conference in Mumbai that there were thousands of people who were there. And I operated on a patient in Detroit, and we transmitted the case live to Mumbai. And the people in the audience could see this with 1/1000th of a second delay from here.
Oh, I see.
Now, we didn't have 5G at that point, so we had to do this through the internet. And the liability of doing it through the internet is that anybody can hack into it.
Okay.
And so, could they make the operation look different, or could they destroy the thing? So now, if I'm doing the operation and somebody hacks it on the internet, it doesn't matter. All that means is that the people in Mumbai are not able to see it. But if I am doing an operation in Mumbai and somebody hacks on it, it'll be difficult. So the way that we got around it with all our regulations is by having a military satellite. So we had to write a proposal to the military to allow us to buy satellite time, and they would sell it to us in 4-hour blocks. Even though it only took me an hour to do the operation, we had to pay for 4 hours satellite time. And it was $25,000 an hour that we had to write a check. So it was $100,000 just to do the procedure. Oh, wow. So it's not economically, I mean, if you are...
I know, I get your point. And overall cost factor of the robotic surgery, is it likely to come down, like how computers used to cost such a big fat money and today you have on your palm top a mobile phone like that?
Yeah, I think the interesting thing is why has it not come down? Look at the change in cell phone technology from 2000 to 2021. And the robot is pretty much the same, and the price has remained the same. The price of the cell phone has come down 5-fold, 6-fold. Okay. And I think those are business industrial decisions that are made. The only robot that has been tested and that works is made by one manufacturer, Intuitive Surgical. And so the price of the robot reflects on the cost that Intuitive imposes on the customer. I mean, in a free market economy, if there were 10 robots, there would be a price war and the price would come down. So
hopefully, doctor, and I wish that more and more people get benefit of this wonderful technique that is available to the people who have been affected. For you who once landed in Philadelphia with just $8 in pocket, and you have come to such a big prominence of for having achieved so much in your field of expertise. Just want to take your message for the fraternity and for the society, so that we know that it comes from the person who truly deserves the place where he is today. Just with these words, we'll close the interview.
I can tell you what has defined my life, but I am not bold enough to say that this is a message for anyone else. For me, it was clearly what my mother and my grandfather instilled in me, and this is exemplified in various mottos of the places that I have worked at. And one of the mottos is the motto of Phillips Academy, which is a private school that my son and my daughter went to. And it is non-sibi, not for yourself.
Okay.
Don't do anything because you are going to benefit out of it. God put you on this earth to help other people, so do things that are for the greater good of mankind. And the motto for JIPMER was Veritas Curat, which just means that truth cures. So for me, I have spent a lot of time making sure that I spoke the truth. I have surrounded myself with people who would be critical of what I'm doing and would question what I'm doing every day of the week.
Excellent, Doctor. Excellent. Yeah, it's a great take for me, and it's wonderful talking to you, Doctor, so much. And in midst of your busy schedule.
Take care and say hello to Mrs. Mani, and good talking with you. Take care.
Yeah,
bye.
Thank you. Bye. Thank you all. Bye. Take care. We'll see you soon with a talk show with another luminary very soon.